Today, we are going to be talking about fatty liver. This is a much needed discussion because there is so much misinformation out there about fatty liver, what causes it, how to treat it, how many people actually have fatty liver. So much misconception around this topic. So we are going to clear that up. We're going to start talking about what fatty liver even is, how it is how that process even begins, what you can stop doing to help your fatty liver, and then what you can begin doing to help reverse fatty liver. Now, in most circumstances, fatty liver is reversible. And I just want to say there are tons of people with fatty liver who have no idea, kind of like insulin resistance. Like insulin resistance runs on a spectrum, right? So you can have very, beginning stages of insulin resistance to very advanced stages of insulin resistance, which would basically be type 2 diabetes. Type 2 diabetes reliant on medications and insulin would be the very severe form of insulin resistance, whereas just the starting, little bit of blood sugar dysregulation, weight loss resistance, having to eat all the time, getting some central obesity, those types of things are the very start of insulin resistance. So it kind of runs on a spectrum. But with fatty liver, the spectrum looks a little bit different. And after I go through this information, I do want to talk a little bit about my mom and how she has been struggling with fatty liver for, we now know, decades. Of course, she was just told to watch it for years and years, and now it's gotten to the point where it's cirrhosis. But I will talk more about her story in a few minutes. But basically, fatty liver is kind of running on a continuum as well. So there's a, very mild form of fatty liver where maybe 20 to 30% of your liver function is compromised, because I do want to say, and I would say this over and over, like your liver is such an amazing organ. You need to appreciate your liver and get it into good health because it does so much for you. And that's why, when you hear of somebody who is maybe diagnosed with liver cancer or has an infection in their liver, it can be really bad news, right? Like if we are people who get liver cancer, the prognosis is usually pretty dismal because of all of the things that this amazing organ does for you. So you really want to take good care of your liver. But going back to the spectrum, so mild liver, fatty liver would be maybe 20 to 30% malfunction of the liver. It's not functioning to peak capacity. And you probably won't know, just like with insulin resistance, you won't know that you have fatty liver until it's pretty advanced, because your liver is so amazing that it's going to do everything in its power to take on whatever you're throwing at it and function as best as it can, even though you're throwing tons of toxins, tons of sugar. We'll talk about all of the things that compromise your liver and its function, but it can really, be in a compromised state and still, like, you don't know that you have fatty liver because of how resilient the liver is. And so then it can, progress to a more moderate fatty liver to a more severe fatty liver. And this is honestly where people are diagnosed. Like the moderate to severe fatty liver is where people are like, starting to feel run down, tired. They might get some blood work done and their liver enzymes would be elevated. This would be ALT and AST. Those are your main liver enzymes. So if those are elevated, that can be a sure sign of fatty liver. The other way to diagnose fatty liver would be through a scan. So it's hard to know, that you have fatty liver until you're at that more moderate or severe stage, because your body is so good at just living with a liver that is not functioning optimally. Now, I will say, if you have, obesity, you have longstanding obesity, and you have struggled with your weight for a very, very long time, and you have severe obesity, you there's an 80% chance that you have at least some degree of fatty liver. They kind of go hand in hand, and I'll explain why. And same with type 2 diabetes. If you have type 2 diabetes, you likely 80% have at least moderate, if not more, or mild or moderate, if not severe fatty liver, because they're all driven by insulin resistance. So if you have insulin resistance, that's driving prediabetes and type 2 diabetes, it's also going to clog up the liver and cause fatty liver. And then from the severe fatty liver, you will progress to liver cirrhosis. And this is basically, so the liver's been fatty for years, probably decades. And then it progresses to cirrhosis. And this is where scarring starts to happen on the liver. Now, fatty liver is reversible. You can basically starve the fat. I don't want to say starve, but you can burn, that's a better term, burn the fat out of your liver and reverse that fatty liver. But once it gets to the point of scarring, it is then not reversible. So, and then once it gets to cirrhosis, there's actually 4 stages of cirrhosis, like 1 being more moderate cirrhosis, and then 4 being severe cirrhosis, where your liver is really not functioning well at that point. So from the cirrhosis stage, you progress past stage 4 cirrhosis. That's where you're basically, it's cancerous, or you need a transplant at that point, because your liver is not going to be functioning, and your body, your well-being, your health, your life is going to be severely compromised at that point because of what the liver does. So let's talk about what that liver does. So I'm going to be kind of oversimplifying things here, but the main things that the liver does is basically just take energy and put it into a usable form. Okay. A lot of times people think they just eat food and bam, like it's utilized as energy. So much needs to happen, not only with digestion, but it also needs to be shunted to the liver, and the liver decides what to do with that energy. So, you might have heard how the liver controls our metabolism, and that's basically why. So the energy is broken down and fed into the bloodstream, right? So if you eat carbohydrates, they break down into glucose or fructose, which we'll talk about in a minute as well. But carbohydrates are going to be broken down into glucose or fructose and then shunted into the bloodstream from the digestive tract. Fats are going to be broken down into fatty acids. And again, through the digestive tract, going in from the digestive tract into the bloodstream as fatty acids. And then proteins are going to be broken down by the digestive tract and then, shunted into the bloodstream as amino acids. And once that energy is in the bloodstream, it's basically the liver is going to tell that energy where to go. Like insulin will put the energy into the cells, but if all of the cell like energy storage is filled, so I've talked about this before on the podcast, when we eat carbohydrate, it's broken down into glucose or fructose. And all the cells can use glucose. They can't use fructose for energy. And that is why fructose becomes really problematic to the liver. But we can break down and utilize carbohydrates in the form of glucose, but we only have a finite amount of glucose storage in the form of glycogen. So we can store glycogen in our muscle tissues, so our muscles can use that energy when it needs to. So it's stored there, and it's also stored in the liver. So when our energy stores start to run out, our liver can say, oh, cool, I have some glycogen here. I'm going to put this out into the bloodstream. And there's a huge vein that runs into the liver called the portal vein. And that's how, the liver is feeding the body from its stores if necessary. So there's glycogen stored in the liver that is broken down when necessary, but the liver can only store so much glycogen, and the muscle tissues can only store so much glycogen. So what happens to the energy after that? It doesn't just poof, like, dissipate through your skin. Like that energy's got to be dealt with. So what the liver does is it takes extra carbohydrates, extra sugar. Once you have those glycogen storage, like think of it as like little buckets all over, like buckets that are in your liver, buckets that are in your muscle tissue. The buckets are full, but there's still a lot of energy coming in, too much carbohydrate, too much sugar. Your liver then has to convert that sugar to fat. And that's where, so there's constant bombardment of energy, eating from the time we get up till the time we go to bed, eating way too many carbohydrates. Your body has to convert those to fat once the glycogen stores are full. So this is how, and it's like when someone explains it to you, it's like, oh, duh, like no wonder my liver is fatty. Once the carbohydrates are at full capacity, then your body will convert them, the liver will convert them to fat. And so you can see why the liver gets fatty. It's like one of the first organs to get fatty, because your liver, your poor liver will do its absolute best to keep up with all of the crappy processed foods, ultra processed foods and sugar that we're eating, simple carbohydrates, all of the grains that we've been told to eat. Your body will do its best. Your liver does its absolute best to convert these to energy. But if you're sedentary, you're eating a lot of times, a lot of different times throughout the day, you're eating a lot of carbohydrates, you can see why you start to convert these, extra carbohydrates to fat. And then the liver gets fat, the organs get fatty. There's a lot of central obesity that starts to happen. And that's, one of the main things that the liver does. And so you can see how this then, like, insulin resistance really pushes fatty liver, because we know when our insulin levels are high from eating too often, eating too many carbs. So the same things will exacerbate fatty liver and insulin resistance. But if you have insulin resistance, then your insulin hormone being high will tell your body to store fat and store energy. So you have too much energy coming in already. Your liver doesn't know what to do with it. And then you have insulin resistance and high levels of insulin. That insulin hormone's telling your body to store. And your liver, your poor liver, is basically screwed, right? It's like, okay, now I have to store this energy because insulin's telling me to store it, but there's nowhere to put it. So then it's just going to keep converting all of that energy to fat, because you're not burning it off. Your insulin levels are high, and it just insulin resistance exacerbates fatty liver exacerbates insulin resistance. So the, both conditions, they're basically, one is playing a role with the other. Both are treated in the same way. So the other thing that the liver does is to filter toxins. And we just had Dr. Wendy Trubo on last week talking about how toxins in our environment can really overwhelm the liver very, very quickly, because the liver is what deals with all of the toxins that come into our body. And she talked about how many toxins, chemicals, things that are in our foods, things that are in our personal care products are fat soluble, and our body can't deal with fat soluble. They can't detoxify fat soluble substances. They either have to store it in the fat, or the liver has to convert these substances to water soluble substances, so that it can then put them back into the digestive tract to get rid of through the bowel. Or we can sweat them out. One of the, there are different ways to detoxify them, but as fat soluble chemicals or toxins, we can't deal with those. They have to be converted to something that's water soluble, and the liver does that. So now if you have a fatty liver, you have insulin resistance, you're taking in a lot of toxic chemicals, or breathing them in, getting them through your water, through your food, your personal care products, your laundry detergent, plastics, whatever it is. You can see how your poor liver gets very, very overwhelmed. And Another thing that comes into play here are medications, and even over the counter medications. Like, you would think taking something like Tylenol would be very benign, but if you actually look at the label of Tylenol, like, you can overdose on Tylenol because the liver has to break that down and deal with it. So we think of anything that we just buy in the pharmacy that's over the counter being no big deal. Like, I have a headache, I'm just going to pop a Tylenol, I'm going to pop an ibuprofen, whatever it is. I'm just going to take this little over the counter thing, and it can be very toxic on our livers and our overall well-being and our health. So those are the main things that the liver does. It's like I said, it's really, really an amazing organ. But our everyday lifestyle, our standard American diet, all the chemicals and toxins that come into play, you can see why our livers get quickly compromised. So another thing that really that I haven't really spoke about yet, but alcohol is a huge factor with fatty liver as well. And we used to, like, even 10 or 20 years ago, like, non-alcoholic fatty liver is pretty, like, it is an issue that's really just come into play in the last couple of decades. And even when I was just coming out into the dietetics field, we didn't hear about non-alcoholic fatty liver disease all that much like that. And that was just a couple of decades ago. It was mostly, if you had fatty liver, it was due to alcohol. Like, it was alcoholic fatty liver disease, because when we drink alcohol, it's a poison, right? Like, your body's like, holy moly, what is this? I got to get rid of this. It's a poison. I can't store it. It's toxic. And so it'll stop everything else to metabolize the alcohol so that it doesn't overwhelm the body and kill you, basically. So it shuts off fat metabolism, shuts off carbohydrate metabolism, stops what it's doing basically to deal with alcohol. And alcohol is very closely processed to how fatty acids are processed. So that's why if the liver's overwhelmed with alcohol, not only is it a toxin and it's wreaking havoc that way because the liver's having to deal with it right away, but it's also processed much like a fat. And so if you drink excessive amounts, the liver can grow fatty. But in this day and age, it's mostly due to our standard American diet, our sedentary lifestyle, eating all the time, and having insulin resistance that is really driving fatty liver disease. So I hope that makes sense. Now, let's talk about the things that really exacerbate fatty liver that we should really take a look at if you're diagnosed with fatty liver disease. And if you are, highly encourage you to get into Low Insulin Academy, my course that will teach you all about reversing insulin resistance and reversing fatty liver disease. But in that course, there's 37 lessons. You can do it on demand, or you can do the live version. My next live version does not start until September of 2023, but you can get yourself on the wait list and you can do the on-demand version right now. And then if you want to upgrade into the live version, which includes group coaching, you are welcome to do that. But all of this is taught inside that course. So it's the best money that you will spend, because you will recover your health by learning everything in the lessons and implementing them, and having your health back and having it back sustainably. Like, these are not things that you just do for a couple of months. It's not like you're popping pills or doing some weird diet, or you're ordering food from a website. Like, no, these are things that will sustainably let your health come back. That's not a good term to use. That will sustainably let you recover your health and do it for a lifetime. So anyway, that's my rant about Low Insulin Academy. But these are the things that you really need to watch if you have fatty liver, that's going to help you reverse it. Number one, getting alcohol out. We talked about that. And again, because this is on a spectrum, some people have really severe fatty liver disease, like they have very severe insulin resistance. You have to decide, where are you at in that severity? Like, someone like me, someone might look at me and say, well, how come you can do a little bit of sugar or you can have a little bit of alcohol, which I don't drink alcohol. It's very, very rare. I mean, if it's a couple of drinks a year at this point is what I've done for alcohol. And I've pretty much decided to completely give it up. But if somebody is more insulin sensitive and they have a high functioning liver, they are able to handle a little bit of alcohol. I wouldn't suggest it. I don't think alcohol is helpful really in any regard because it is a poison and it is toxic, but you need to make your decisions about your own lifestyle. But that is the first thing if you have fatty liver, to get it out of your nutritional intake as much as possible, or severely limit it because it's just exacerbating the problem. The second thing is sugar. Now let's talk about sugar and why that's so problematic. So we know that sugar and carbs, and ultra processed foods with a lot of carbohydrates, simple sugars, breads, donuts, pastries, waffles, pancakes, all of those things basically just dissolves into sugar, into our body, breaks down into sugar, right? So we want to get those out of our body because it's overwhelming our liver. We have too many carbohydrates coming in, too much sugar. Your liver is converting it to fat. Okay. So sugar and alcohol, like sugar is the real problem in ultra processed foods when it comes to fatty liver. We've been told that it's fat, and yes, fake fats, man-made fats can come into play here, but real natural fats are not what drive fatty liver. It's sugar and ultra processed foods. And why sugar is so terrible for our liver is because, like, I'm talking about white table sugar. Of course, there are hundreds of different kinds of sugar at this point, but white table sugar is one of the worst. High fructose corn syrup is right there with it because table sugar is 50% glucose and 50% fructose. Now, this is where this information that you're going to hear might be mind-boggling, and you might not have ever heard this before, but I'm here to tell you the truth. 50% glucose, 50% fructose. Fructose overwhelms the liver very, very quickly, because all the cells can use glucose, or just about all the cells can use glucose as energy in the body, but they cannot use fructose. So what does your body do to it with fructose? It shunts it to the liver. The liver is the only organ that can deal with fructose when you ingest it. It is not used by the cells in your body. So let that sink in. If you are drinking 6 sodas a day, even a couple sodas a day with high fructose corn syrups, it doesn't even have to be soda. It can be sweet tea. It can be fruit juice. Fruit juice can be very, very high in fructose. Even though it's not high fructose corn syrup, it's high in fructose because fruit is very high in fructose. You're drinking sugary drinks, you're eating candy, you're eating other foods with high fructose corn syrup. Your liver is going to be very overwhelmed. Now, when we look at how we, grew and developed as humans, we had a little bit of fruit available to us, right? Maybe a piece here and there. Maybe we only had fruit a couple months out of the year, and it's wrapped with fiber. And a little bit of fructose can be okay in the human body. It's not a big deal. But when we're taking in all this high fructose corn syrup and we're eating candy and drinking drinks with fructose in it, your liver becomes very, very overwhelmed. So fructose in high amounts can almost be as bad as alcohol. And it is for a lot of people. It overwhelms the liver very quickly. And I do want to say something about glucose meters right now, and continuous glucose monitors. Those monitors monitor what we say they're monitoring. They're monitoring glucose. Okay. So fructose, like fruit, and things with fructose might not have a huge bearing on your blood sugar response because your cells aren't using it, or your cells, can't use fructose for energy. But those glucose monitors are measuring glucose. They're not measuring fructose. And so you might say, agave nectar is a really good example of this. There was, for a couple of years there, it was like, oh, agave nectar and agave syrup is all the rage. It doesn't do anything to my blood sugar. That's because agave nectar and agave syrup is very high in fructose. It's one of the highest fructose foods, or if you even want to call it a food, foods that is sweeteners, or that we'll say sweeteners, that is available. It's really high in fructose. So it doesn't do a whole lot to your glucose response because it's not glucose, it's fructose, but it very quickly overwhelms the liver. So fructose really needs to be very, very minimal, if not completely taken out of somebody with fatty liver. And again, sometimes on Instagram, I'll post that I'm eating berries or I'm eating an apple, or even once in a while, I might have a banana, maybe once or twice a month. And someone like me, I don't have fatty liver. I don't have insulin resistance. I don't have type 2 diabetes or prediabetes. I am very metabolically flexible and I'm very insulin sensitive. I can afford to have those foods every once in a while. But if you have severe fatty liver or you have severe insulin resistance, type 2 diabetes, you really want to think about, keeping fruit juice, I would avoid completely, but keeping fruit very minimal. Again, it's not the fruit that got us in trouble if we're eating just a little bit. But if we're having smoothies and we're eating 5, 6, 7, 8 servings of fruit a day, that's a ton of fructose and it can quickly overwhelm our liver. As humans, we were not meant to be eating 7 to 8 servings of fruit every single day. So fructose is definitely something you want to avoid if you're struggling with fatty liver. And then, of course, any drugs, over-the-counter drugs, for reasons that I have already stated, these can quickly overwhelm the liver because the liver's already compromised, and these are just going to make it more difficult for the liver to function properly. And then even when we look at grains and bread and pasta and rice and potatoes, like I teach a low carb approach. And if you have insulin resistance, you're really keeping carbs minimal because you're not processing them well, right? Your insulin's high. Your body's being told to stuff energy into the cells all the time. We need to stop putting so many carbohydrates into our body if we have insulin resistance, and we need to increase our protein and our natural fat so that your body can burn fat and ketones for energy rather than carbohydrates, because carbohydrates is going to make insulin resistance worse, right? And exacerbate it. So again, there's different levels of carbohydrate. Like I teach anywhere from 25 to about 100. And if you have really severe disease, you need to keep those low to let your body heal, reverse the process of fatty liver and insulin resistance. Once you reverse the process, then you can add a little bit back in when you're more insulin sensitive, but it does take some time. So things like grains and breads, pasta, rice, even if it's like whole grain bread, whole grain rice, whole grain this or that, like our society and our food system loves to just slap whole grain on everything and people think that that's okay. It's still a lot of starch. It's still a lot of carbohydrates. It's still going to drive this disease process. So you really need to just keep those limited. So those are the things you really want to keep limited if you're struggling with fatty liver. That is what's going to move the needle, because what you want to do is bring the insulin levels down low enough so that your body can start the fat burning process. You want to burn that extra fat out of the liver so that it's not fatty anymore. And so when we are burning extra fat in our bodies, it's not all stored, we're not just going to burn all of the fat that's stored on our thighs or our hips. Like your body's going to burn out that fatty liver first, because that's a toxic fat and it is compromising your health. So your body's going to really work to burn that fatty liver out and burn that fat around the vital organs, because it is more harmful to the body. So you're going to start there. And then adding, talked about all of the things that we want to kind of take out. Exercise is going to help because you're going to, burn those glycogen stores. You're going to burn the glucose that's in your body so you don't have as much of an insulin spike. All of the things that we've talked about on the podcast. But you also want to think about, switching your fats from any kind of vegetable fats that aren't really vegetable fats, but the seed oils, and switching over to things like butter, coconut oil, extra virgin olive oil, healthy natural fats that are not processed, and using those as energy so your body's allowed to bring, you can bring the carbohydrates down. You can start to reverse the fatty liver and the insulin resistance. Vegetables, non-starchy vegetables are very helpful for the liver because they have fiber and they also have nutrients that help support overall liver function. So non-starchy, higher fiber vegetables. And then of course, people have been told that red meat and eggs drive fatty liver, and that is just not true. That is misinformation. Eggs and meat and red meat, especially that is properly sourced, will help reverse that insulin resistance. It'll help to reverse the overall carbohydrates that you're taking in. It helps with satiety. We know this from listening to the podcast, and those my students that have converted over to a higher protein diet with natural fats and limited carbohydrates know that this is true, and they start to reverse their disease process and their labs improved, and then their weight issues just start to resolve on their own. And then you can think about things that really support the liver. I mean, hydration is really important as well. And then hopefully, when you work in my programs, one of my goals to get you off medications or at least reduce them. And that will bring the toxic burden of the liver down as well. We want to get, toxic chemicals out of our everyday personal care products. All of that is going to help. But things like turmeric, curcumin, milk thistle, those are all good supplements to try for liver support. I am not giving medical advice. I'm just saying overall, these supplements have been found to improve liver function if you have fatty liver. Remember, fatty liver is reversible. Once it gets to the stage of cirrhosis and scarring, then it's not reversible anymore. And that scarring is there to stay. So with that is, how fatty liver is really caused and how you will reverse it. So get into my program, my Low Insulin Academy, if you need to reverse fatty liver. But I did want to say just a few words about my mom. I said I would come back to her case and her fatty liver. So she's had fatty liver for at least 20 years, I would say, because I went to an appointment with her last year and she had elevated liver enzymes dating back at least 12 years, which she was told to watch by her primary care physician. Just watch, keep doing the labs. And all of a sudden, it's progressed to where her liver function is compromised, and she had a scan done, and she's actually to the stage of cirrhosis. She's in type or stage 1 cirrhosis, but she does have scarring on her liver that is not reversible. And if it continues to progress, it's going to get to the, type 4 cirrhosis is where your liver is basically not functioning anymore. So I was very irritated because she was told to watch this for more than a decade. And it was probably, so 12 years ago was when she was having elevated liver enzymes. So it takes 10 years or so at least to develop insulin resistance and fatty liver. So she's probably been dealing with this for many decades and was just told to watch it. But then I went to an appointment with her to a hepatologist, a liver specialist, and they did a really good job with explaining fatty liver and the different stages of cirrhosis and where she was at. But then, they didn't address diet at all. They didn't even bring up fructose. At one point, I had told the liver specialist that she was doing some intermittent fasting and low carb approach to help burn out some of the fat in her liver. And he just kind of looked at me blankly. And then I said, well, she should at least limit fructose, right? He did not know what fructose was or what foods it was in. This is a conventional hepatologist, so not trained to even know how fructose overwhelms the liver and overwhelms it very quickly. So I then asked if she could get a fasting insulin. This is her next follow-up appointment. I asked if she could get a fasting insulin done, and they said she had one done. And I'm like, no, that's her fasting glucose. So they didn't realize that glucose and insulin were different tests, and it was a big rigmarole to even get her fasting insulin levels checked, which it was elevated. So she has insulin resistance and fatty liver disease. And thank goodness I am there to educate her. She's not always compliant, I will say. And I know that a lot of people struggle with compliance, but you will likely, if you're not working with a functional or integrative doctor, you'll just be told to watch it. And you probably won't even be asked about diet. You'll just maybe, my mom was put on some medications. One was supposed to help with blood pressure, and I don't even know. And, medications are just exacerbating the problem because they overwhelm the liver even more. So it's really, really backward. Which is why I'm so glad you are listening to this podcast. If you know somebody with fatty liver or you know someone with insulin resistance, please copy this link and share it with them, because they deserve to know what really causes fatty liver and what really reverses it. So just grab the link, copy it. And then, of course, leaving a ranking and review on iTunes, on Apple Podcasts really helps the podcast grow. But, the least you can do if someone with fatty liver, whether they listen or not, that's not up to you, but you've done your part with at least sharing the information. Share it on your social media. If you're on Instagram, take a screenshot of the podcast episode that you're listening to, share it. I'll share it. I'll reshare it on my story. But that really gets the word out and helps more and more people learn the truth about their fatty liver and how to reverse it. So I hope you learned a lot today. I'll see you back next week for another episode.